Hi, this is Dr. T and welcome to my office. This is a Q&A video. Okay, so looking at a few of the questions I've gotten so far, what's the difference between glycolipids and glycoproteins? Okay, so in this case we've got compounds that fit into kind of two categories. This is because, nature does not cleanly divide things. The way we do this is that the root, the back end of the word, is the dominant one. So glycolipid is mostly lipid. So it's probably going to be a fatty acid, or actually it's probably going to be more of a phospholipid, truth be told. Although this could be a fatty acid. I think there's some sterols that will do this. And then the glyco is indicating that it has carbohydrates attached to it. So you have what's probably a oligosaccharide attached to what's probably a phospholipid. Once again, it could be a fatty acid, could be a sterol. It's just depending on what's going on. But kind of the typical one is going to be a phospholipid. This is going to be attached to the phosphate. And so you've got something that's both lipid and carbohydrate, but it's mostly a lipid. A glycoprotein, on the other hand, is same story, but it's not a lipid it's attached to, it's a protein. So you got a protein that, once again, onto some of the amino acids have been attached carbohydrates, probably oligosaccharides in this case. And cells use these for things like communication. If you're thinking of your ABO groups, that's going to be, I believe that's a glycolipid. You've got other proteins that'll have oligosaccharides. Those are quite often used for like shipping labels. Essentially, this oligosaccharide means go here, kind of thing. That's a lot of what the Golgi apparatus does. Not just that, but it does a lot of stuff. So yeah. So the next question is kind of in the same vein. What are LPS? So LPS, lipopolysaccharides. So once again, that kind of same hyphenated system. They're cores of polysaccharide. And so this is going to be a big carbohydrate. And then it's a lipo, so it's got lipids attached to it. And I believe in this case, they are fatty acids. So you're going to have these fatty acids hooked to one end of the lipopolysaccharide, and that's going to allow it to interact with the cell membrane. And specifically, these are used by gram-negative bacteria. Gram is a stain. Some bacteria get stained with gram. Those are gram-positive. Others don't. Those are gram-negative. And there's a fairly major difference in how those bacteria are structured, which is why it's a useful characterizer. Anyways, these are going to be put on kind of the outside of the gram-negative bacteria. They're part of how they do their thing. For us, really interestingly, is they're one of the major targets for our immune system. So if our immune system sees lipopolysaccharide, it goes absolutely ballistic. And it can go so ballistic that it can lead into what's known as septic shock. Your immune system is going so hard trying to fight an infection that it actually causes collateral damage and can be lethal. Now, this had been known originally from soldiers who had gotten severe wounds on the battlefield that then did not get taken care of particularly well. There have been other issues with septic shock, including young women who have not changed out tampons on a regular basis, so leaving it in for weeks or months. But can also be a problem even when there's no bacteria at all. And this is the interesting part. The bacteria is not the problem. It's the immune response to the bacteria. So if bacteria start growing in injectables, so this is going to be pharmaceuticals that are going to get injected into you. Now, if it's growing in something you're going to eat, your stomach will just fry this stuff. No questions asked. The main thing is it's getting straight into your bloodstream without going through your stomach or something. So if these get into injectables, even if the bacteria are killed, totally obliterated, if the lipopolysaccharide is still there, floating around you, then your immune system is going to recognize it. It's going to, once again, go attack, and it can lead to septic shock, which, of course, is really bad. The thing that just injected into you in order to make you better is now potentially going to lead to a lethal condition. So what we do to protect ourselves from this one is not really an approach of just getting rid of the lipopolysaccharide, which I'm not really up to date on how well that is done or how that's done, but the main thing we have to do is just make sure, is it there? Most of the time it's not a problem, but if it is a problem, we're going to have to deal with it, and dealing with it might be clean the solution or just throw it out. And the way we test for this, oddly enough, uses horseshoe crab blood. So you take a horseshoe crab, you take some of its blood out, which the horseshoe crab usually survives, not always. So we're working on ways of doing this without the actual horseshoe crab. But the horseshoe crab's immune system has a method where it clots very aggressively. when it experiences lipopolysaccharide. So we take some horseshoe crab blood, we purify it, get only the proteins involved in the clotting process, mix it with a small sample from the injectable in question. If it forms a clot, you got a problem. If it doesn't, you're good to go. So yeah, lipopolysaccharide, definitely an interesting little molecule. Okay, how do antibodies recognize their target? So antibodies are going to be small proteins or peptides, small proteins. And so they're going to have at their ends a series that gets effectively randomly assigned when the immune cell that's making them gets produced. So these immune cells are going to get produced in the white blood or in the bone marrow. You're going to get your white blood cells. And during their developmental phase, they're going to edit their DNA in such a way that you're going to produce what is a very much a random approach for making these antibodies. And it's going to be the tips of the antibodies. The antibodies kind of have this Y shape to them, and it's at the tip of the Ys. Now, these amino acids are going to have various intermolecular forces in various orders and various positions. Now, if you have an antigen, that's the target of an antibody, that just happens to have the intermolecular forces located in the right position so that it can make a nice, strong binding with the antibody, then the antibody will stick. And then that particular white blood cell goes, oh, I've hit something, and starts replicating like crazy to build up your defense against that. So hence how, things like vaccines work. But the actual sticking is by having assorted intermolecular forces. So you've got, some amino acids, they're kind of curled up over there. If their intermolecular forces are of such that will bind to a certain antibody, then they do. Next question's related. Can you explain what ELISA is? So ELISA is enzyme-linked I am going to butcher this. I'm going to put it on the screen during editing. Okay, but ignoring me that I can't do an acronym. The goal here on ELISA is that you're going to take, and there's a couple of versions, there's like half a dozen at least, but there's several versions of it, but the kind of the core of ELISA is you're going to be looking for an analyte. An analyte is any molecule that is the thing of interest. You're trying to see if it is there and how much there is. Now, obviously, depending on what you're doing, which one of those two statements is more of a priority for you. So the way you're going to do an ELISA is you are going to take your analyte and you are going to, in one way or another, trap it. So you can either put it on a surface that it normally sticks to, or you can use an antibody to trap it. And then you're going to apply an antibody or another antibody, depending on which version you got. And that antibody will bind to your analyte. So now you've got the antibody bound to the analyte. The reason you're using an antibody is because those are very nice and specific. You take a mouse or a rabbit or a goat or a horse and you inject the analyte into them. They produce antibodies against it. And then you'd make it, you'd do some double checking. But those antibodies should bind to that analyte and not other things. At least that's the goal. It's not one that always happens, but that's the goal. Obviously, you want to check it, see if it does have other problems. Anyway, so now that antibody has bound to your analyte. The next step is going to involve either another antibody or something that's going to attach to that antibody that you can see. So this could be a fluorophore, so something that fluoresces. This could be a nanoparticle. This could be a chromophore, something that's colorful. A popular choice is horseradish peroxidase, which is an enzyme that, with a few other specific chemicals, will allow you to manufacture a purple dye. All of this said, you are able to, through what is usually a rather inordinate number of steps, detect how much of your antibody has stuck to the analyte and how much you have washed away or is not sticking. By knowing this, if your analyte sticks, then presumably it's sticking to the antibody. And by having those stick, then you know that your analyte is there. And if you've done so in a quantitative way, you also know relatively how much of your antibody is there. Or I keep getting the switch. Analyte. There, that's the question I'm going for. Analyte. which in this case would also be the antigen. The antigen is the target of an antibody. Analyte is the thing you're interested in. In this case, the same chemical could be described as both ways. Okay, wow, that was annoying. Yeah, so the long story short is, take thing you're interested in, get it so it doesn't move too much, put an antibody that targets it in there and not other stuff, and then see how much of your antibody has stuck. The more that it sticks, the more of that thing you're interested in is there. So the next question is related, how could this be used in kind of a medical setting? So obviously, you've got a way of measuring if something is present and how much. So anytime you want to know that information, so you could look for a biomarker. That is a biomolecule that indicates something has happened. The classic case is a pregnancy test. The ones where the user puts urine on a stick, the urine wicks up through the device, grabs some antibodies in the process. If they bind to particular hormones that are representative of pregnancy, then it changes colors. And if they don't, then it doesn't. And it usually has some control systems just to make sure it worked. So that's why there's usually two lines on them. One is the control, one is the actual. You could do this for drug testing, and a lot of drug testing is done this way. If the drug in question or something that's been a byproduct from the drug is usually more often the case, is exposed, then the antibodies stick. Usually this is not of such a gold standard that we just run with it. You know, you don't want to lock somebody up on a test that works most of the time. You want to make sure it is all the time. So this is usually done as a first screening for something like high performance liquid chromatography or something like that. The beauty of ELISA is it is super fast. We're talking minutes to do. We're geared up to do a lot of these. This is once it's been worked out, they're a pain to get going. They're a pain to get the first one done and to figure out how to actually get it to work well. But once you get them working out, once you get the bugs removed from your particular ELISA assay, they are super easy to work with. Currently, we've got the whole COVID-19 problem, and one of the goals of researchers is to move from what we're currently using as a polymerase chain reaction based assay. And the assay takes a long time to run. We're talking several hours just to do the assay. This isn't talking about the mailing it to the lab, the backlog, or anything like that. That's all just goes through the roof. As well as it requires specialized equipment. One of the goals is to get an assay functional, and as the time of recording, I have not heard of this being successful yet, but I know this is going to be something that will be very much desired. Getting an ELISA-based assay, or one that's using antibodies in one way or another. There's a couple of different ways you can use antibodies other than ELISA. Then, by doing that, you can take an assay, whereas detecting the RNA sequence, which is what PCR does, which takes hours. Detecting probably a protein in the virus sheath is usually what most ELISAs would be looking for. By doing that, you could make an assay that would take minutes. That could be done, if not in front of the patient, in the doctor's office potentially. Maybe needing a lab depending on exactly how you set this up, but not something we're going to need a specialized lab. So this is one of those areas where an immuno-based assay would be wonderful if we could do this. Alternatively, you could be doing an assay not for the virus itself, but for the antibodies that target the virus. That's how you do a few of the other diseases. So with that said, that was the questions when I checked these for today. I'll be making a few more of these videos. Stay safe. Have a wonderful day.